I'm Dr. Samantha Barry. I'm a resident in dermatology at Rush, meaning I've been a physician for almost 3 years now. I'm here with Dr. Arthur Rhodes. He's a professor in dermatology at Rush University Medical Center. He's been a physician for nearly 50 years. Today we'd like to talk to you a little bit about sensible skincare. The reason why this came up is about a year ago. We were running a clinic on Saturday and we noticed several patients were coming in with the same complaint. They were having dry, itchy skin in the winter and they didn't really know how to take care of their skin. Because of that, we'd like to talk to you a little bit about the best ways to take care of your skin. With that, Dr. Rhodes, tell us a little bit about why to use soap.
Well, soap. Everybody knows what soap is. What's the purpose of soap? And to say to clean your skin is only part of the issue. The question is, what part of your skin do you need to use soap on? The whole purpose of soap, which is surfactant, detergent, is to dissolve oil into water. There's no other purpose of soap. So you really only need to wash with soap the oily areas of your skin. And those areas are the stinky areas, the armpits, your crotch, and your tush. Those areas need soap once or twice a day. The other areas of your skin do not need soap. Sweat comes off with water. So putting soap all over your skin, is there a problem? There is a problem because it's based really on the way the skin is formed, and it's really the outer layer of the skin, which we'll talk about.
So tell us a little bit about what soap really is.
Soap is a compound, and there are different kinds of soap. All soaps now are detergents or surfactants, and they dissolve oil into water. That's their only purpose. So soap is made up of a compound that has a lipid attracting component and a water attracting component. So try to dissolve oil into water. The oil settles on top. Soap, detergent, sodium lauryl sulfate is the most common and cheapest detergent used in soaps, will allow you to dissolve oil into the water. And you do that with cooking too, so you can make everything homogeneous where you don't get separation of the oil from the soap. So the whole purpose of soap is to dissolve oil into water so it washes away.
So what does soap do to your skin?
That's actually a complicated question, okay. And that's the crux of the question. Before I can even answer that, we really have to talk about the structure of the skin and what the skin does to keep water inside our bodies and bacteria outside of our bodies.
Okay.
So the skin's surface layer is continually being renewed and formed. Every 30 days, it's a new barrier. It's exfoliating naturally. You do not have to ever exfoliate your skin because it exfoliates naturally as the barrier is being formed and reformed continually. It has to do that to preserve the barrier function. The whole purpose of barrier function is to keep water in our bodies and bacteria out. Now, the surface layer of the skin is called the stratum corneum. That barrier is renewed every 30 days. It's made up of bricks and mortar, skin cells, which have a protein that holds water, and surrounding all those cells and holding them together like a brick wall is the mortar of the stratum corneum, and that's a lipid material. It's called glucosylceramide. That fatty material holds the skin together and keeps water inside the body and bacteria out.
Okay.
Now, I mentioned already that the purpose of soap is to dissolve oil into water. Unfortunately, the soap, and really the detergent in soap, will pull that fatty substance out of that barrier, and then the brick wall falls apart. You're pulling mortar out of the brick wall falls apart. So if you use soap on areas of your skin where you don't need it, you're really injuring your skin. Also, what you don't want to do is use anything abrasive on your skin. You don't want to exfoliate your skin. That's silly. The skin exfoliates normally. If you injure the skin, you're injuring your barrier. And when the humidity is low and you have no barrier, that skin surface layer, the stratum corneum, falls apart. Your skin is itchy, it looks dry, lackluster, ashy, and you're uncomfortable, and it dries out. So the trick is to preserve that barrier function.
And what about the barrier of people's skin who suffer from dry skin conditions such as atopic dermatitis, other eczemas, or ichthyosis vulgaris?
So ichthyosis vulgaris, which affects about 1% of the population, is a condition where that barrier is abnormal in a genetic sense. And it's a flip of the coin when that person sires a baby or has a baby, if it's a woman. It's 50% of the offspring will have that same barrier dysfunction. And half those people will have asthma, eczema, or hay fever in addition. The barrier's not normal. The barrier looks like snake skin, although they call it fish skin, ichthyosis, it's a misnomer. It looks like snake skin and dry, ashy, itchy, and susceptible to irritation. What you don't want to do is scrub it, rub it, either with a loofah or a scrub brush. That would ruin the barrier even further. So it's even more critical that folks with any skin condition take care of their skin in a much more defined way.
So after bathing, let's say you're just putting your soap on the oily areas of the skin, what do you do next?
Well, you dry off.
Right.
You use the soap only on your armpits, your crotch, and your tush. That's the only place you need soap to get rid of the oily, smelly materials. And the sweat, of course, comes off with water. You don't have to use soap anywhere else. No washcloth, no loofah. Then you dry off. Now, in Chicago, in the winter, the humidity drops down to 60%, 50%. In Anchorage, Alaska, it drops down to 5%. Everybody is dry and itchy and uncomfortable. And the water easily comes out of the skin because if the humidity is low, that water is going to be pulled out of you to equalize the atmosphere. So everyone is drying out to equalize the humidity in the atmosphere. So it's taking it from us. So you've got to trap that moisture in the skin. So right after you dry off, you want to trap the moisture. And the best way to do it, in my view, is to use something that's safe, something you could put in your eyes and put anywhere safely. And I think the least expensive and safest product is petroleum jelly.
Okay. And where does petroleum jelly come from?
Actually, it's a byproduct of petroleum. And as we know, petroleum is a plant-based material coming from the ground. And it really is made up of plankton, algae, ferns that have been compressed for millions of years to make that fuel that we use in our cars. But a byproduct of that is petroleum jelly. It was discovered in the late 19th century in the first oil well in Titus, Pennsylvania, Titusville. And all the rig guys were using the petroleum jelly, rubbing their skin with it to help them with burns, with chapped skin in the wintertime in Titusville, Pennsylvania. So a very bright man went down to Titusville, a chemist. His name was Cheesebro, and he took samples of it. He developed kerosene from whale oil, so he's a very wealthy chemist. And he took that product and he analyzed it in the lab and started selling it. I won't name the product, it's a very popular product, but it's petroleum jelly, and there's a generic form and there's a brand name of the same thing. So that petroleum jelly can be put right into the eye. The eye ointments are made with petroleum jelly. You can't put lotions and creams in your eye. They're made with detergents, surfactants, emulsifiers.
So explain really the difference between lotions and creams and petroleum jelly-based ointments.
Okay, petroleum-based ointments are pure petroleum jelly. And again, all the eye ointments, they're eye drops that have a different medium, but the eye ointments have a petroleum base, so that you can put in your eye. Now, what is a lotion? What is a cream? A cream is, it's oil plus water, and so is a lotion, oil plus water. But how do you dissolve oil into water so it's homogeneous? You have to add an emulsifier, a surfactant, a detergent, so you have a homogeneous compound. And because it's water-based, you need a preservative. And the preservatives can be sensitizing, so people become allergic to the preservatives. People become allergic to the perfumes that are placed in lotions and creams. And they're quite expensive. And the only moisturizer is?
Water.
Water is the only moisturizer for your skin. So you want to put water in the skin and then trap that moisture in the skin. And you do it like every day in the wintertime, and your skin will be more comfortable and it'll look better. Lotions and creams, I don't recommend at all for the reason I just gave. If they're made with detergents, you're putting detergents on your skin. You're putting surfactants, which are going to pull the fat out of the barrier. It's going to pull the lipids out of your barrier, and you're going to be uncomfortable.
So how do you recommend that one uses petroleum jelly when they get out of the shower?
So how do you use this stuff? After you dry off, I take the petroleum jelly, rub it on the dry areas, and take a towel and then rub it off so you're not greasy. Put it on the face. I use petroleum jelly like several times a day, and I'm 175. No, I'm only 76. But I've been using it for 50 years, and it really helps the skin. It's a good base for makeup for women. The models that I've talked to all use petroleum jelly, and they've been on TV, some of famous ones, talking about plain petroleum jelly rather than lotions and creams.
So let's talk a little bit then about using petroleum jelly on the face. There are some reports that people claim that it may cause acne. Tell us about that.
Well, does petroleum jelly cause acne? There was a famous dermatologist in Philadelphia, Al Kligman, who developed certain medications for acne, some very important medicines that I won't mention, and he did a lot of the work on petroleum jelly in models, animal models, showing that it does not cause acne. There are other compounds in pomades that will cause an acne-like eruption, but not petroleum jelly.
Okay, so if you're using pure petroleum jelly, cosmetic grade, that shouldn't cause acne.
It will not cause acne.
Okay. Do you have any tips for how people use petroleum jelly? One thing I get from some of my patients is that they're concerned that they're going to feel greasy.
Okay, well right now, are you going to feel greasy if you use it correctly? Again, after wetting the skin, then drying it, petroleum jelly, rub it on your hands, put it on the face, other areas, take a towel and wipe it off so you're not greasy.
Okay.
And it's that simple.
Are there certain areas of the body that you feel like you have to apply more times than others?
If you're washing your hands and you're exposed to detergents continually, your hands are going to be raw, chapped, rough, and uncomfortable. So petroleum jellies, very important to use in those areas. And it also depends on the humidity. In the summertime, when it's very high humidity, you may not want to use any petroleum jelly. You don't need it because the humidity is such that your skin's not going to dry out. People with ichthyosis vulgaris, that snake skin, may want to use a little bit after bathing because it may look better. But most people with high humidity conditions probably don't need any kind of moisturizer. But remember, the only moisturizer is water. And in the summertime with high humidity, you probably don't need anything to trap the moisture in the skin.
Okay. Any changes that you make to your skincare routine in the summer? things that you add, things that you take out?
So in the summertime, the sunscreens are an important issue.
Okay.
So people who burn very easily and don't tan, much higher risk for skin cancer, squamous cell cancer, basal cell cancer, and some melanomas, probably are going to need sunscreen so they don't burn. If you have very dark skin and tan very easily and don't stay out very long, you may not need sunscreen. So it depends on your tendency to burn and tan, which will determine whether you need sunscreens. And the ingredients in sunscreens, I'm recommending the mineral inorganic sunscreens rather than the chemical organic sunscreens that are now being banned in Hawaii, Key West, as well as Australia. So I'll only recommend the inorganics, that's titanium dioxide, zinc oxide, or both. And that's the only ingredients I'm recommending. You can use them on newborn babies and women who are pregnant. You can use those. The other organic sunscreens, I wouldn't use them in babies or pregnant women.
So how would you recommend that people ensure that they're using the mineral or inorganic based sunscreens?
I'm sorry, say that again.
How would you recommend that people figure out that they're using the mineral or inorganic based sunscreens?
Well, you want to make sure by looking at the ingredients on any product you buy. Just look for the ingredients, and you only want the zinc oxide and titanium dioxide or both, and nothing else.
Any ingredients in particular to avoid?
Some of the avobenzone, that's been implicated. The other organics have been implicated in causing problems with the coral reef, killing the coral reef, and also accumulating in fish, getting in our water supply. Again, some of those compounds are banned in Hawaii, Key West, as well as Australia.
And what is the concern if those compounds get into the human body?
So the concern about the organic sunscreens is they're called endocrine disruptors. They affect estrogen and progesterone levels in women, and they are also affecting sperm function. So it's affecting the ability of men to get women pregnant, and those are some studies out of Scandinavia. So that becomes a serious question. These compounds have to be studied much more carefully, and before there's general use, and they are in general use, I think they need to be studied more to see if there is an effect on our endocrine function as well as other functions.
Okay. To recap, for dry skin in the winter, we'd like you guys to really just be using soap to oily areas of the body, including under the arms, in the genitals, in the buttocks, following with a petroleum jelly product on any sort of damp areas of the skin, then wiping it, the excess off to remove any feeling of greasiness. That skincare routine can continue into the summer with the addition of sunscreens. Does that sound right?
Sounds reasonable, although I said people who have very, very dark skin may not need sunscreens. This is a controversial area. If you're going to be out in the sun with a high intensity sun for 8-10 hours, even people with dark skin will burn. And it's just common sense, you know, to avoid burning of the skin and causing injury to your skin.
So Dr. Rhodes, nowadays people seem to be really looking for a natural approach to skincare. Some of the botanical oils have gotten very popular in skincare. Can you comment on the use of coconut oils, other botanical oils, shea butter, and things like that?
Well, tea tree oil has been very popular, and it's a possible contact sensitizer, so I'd be real careful with that. I think the research on some of these botanical oils is just coming about. I don't have a lot of experience with it, but sometimes the vegetable oils can be irritating to the skin. I don't know what they would do if you got them in the eyes. So I haven't been recommending the botanical oils. And again, the whole purpose of this lipid compound is to trap moisture in the skin. I think the petroleum jelly does it better than an oil.
Okay.
But some oils, if people are doing the oils and they're happy with them and not having problems with them and taking care of the skin basically like we talked about, I think it's fine as long as you're not having any irritation from the oils.
Okay. So we talked a little bit about how this skincare routine is for everybody, but in particular patients who suffer with dry skin conditions such as atopic dermatitis, other forms of eczema, and ichthyosis vulgaris. How do those patients use their medicines given to them by their dermatologists or other physicians in conjunction with the skincare routine?
Okay, so how do you use medications in conjunction with this routine? If you put petroleum jelly on your skin and then you're going to put an ointment of a cortisone because of inflammation, that petroleum jelly may inhibit the medicine from going in because it creates a barrier. So you'd want to put those medicines on first only to the inflamed areas. You wouldn't put it everywhere. You'd put it on the inflamed areas. You only put it where you need it, and then you can put petroleum jelly right on top.
Okay, so medicine first. Do you feel like the medicine needs any sort of amount of time to dissolve in the skin before applying petroleum jelly?
Probably not. You put it on the medicine, and then you do the other right on top.
All right, sounds good. Can you debunk any myths for us about skincare that you've encountered in your practice?
Well, for babies and children with atopic dermatitis, years ago, they forbade any bathing. And we had kids in the hospital. I was at Boston Children's Hospital for 9 years taking care of infants and children. And the dictum in those days, this is back in the 60s and early 70s, you don't wash the skin, you don't bathe. And we had at least 5 children in the hospital infected atopic dermatitis. And I changed the therapy of atopic dermatitis in those days and said, I want to bathe the babies for a number of reasons. It soothes the skin. It gets rid of the crust and oozing. It reduces bacteria on the skin. And we'd soap first the dirty areas, rinse off, then let kids play in the baths. And the hydration helped the barrier in the skin, especially if we use petroleum jelly after the bath, after we dry the kids off. And we started seeing improvement in children by bathing them.
Okay.
But everybody has to know, in the old days, they weren't bathing the atopic children. It's a little controversial now how much bathing, and I think, in my experience, you can bathe as much as you like, as long as you soap the dirty areas first, rinse off, and do not sit in soapy water, because that puts detergent all over your skin. And then after you dry off the petroleum jelly, then wipe that off. And the medicine would go on first to the inflamed areas if there are inflamed areas.
Okay. So it sounds like what you're really saying is that skincare is kind of foundational to taking care of atopic dermatitis, eczemas, other dry skin conditions, and to really use your medicines for only really red, itchy, rashy, inflamed areas.
Absolutely. You don't want to be putting a cortisone medicine all over where there's no disease, because cortisone can be absorbed through the skin, get into the body, and cause side effects, especially the very potent cortisones. So there's nothing wrong with cortisone medications if they're used properly.
Okay. So we've discussed how to take care of one's body. Another question that seems to come up in clinic a lot is, how does one care for their scalp, or how often should they be washing their hair?
Well, that's a good question. How often do you wash your hair? I have a very peculiar problem myself.
Okay.
I develop a lot of scale, a little bit of psoriasis, a little bit of seborrheic dermatitis, and certain people develop a lot of scale. So what do you do with that? If scale, I said before that the scale from the stratum corneum, that barrier, is continually renewed. It sheds all the time naturally. In the scalp, it's like trees in the bushes. It accumulates, and the dead skin smells. So if you let the scale accumulate in the scalp, it'll be uncomfortable, it's going to be on your clothing, and it will smell bad because it's dead protein. So I recommend shampooing with a gentle shampoo. For people with seborrheic dermatitis, they may want to use a tar shampoo. And then after the tar shampoo or any shampoo, and I recommend usually a double shampoo. The first shampoo brings up the scale, and the second shampoo at the same sitting washes away the scale. But then the hair has a charge because all shampoos are detergents, and it puts a positive charge in the scalp. So the hair is flying away. So you need something that will neutralize that, and that's what a conditioner does. The first conditioner, I think, was lemon juice. So you use a nice conditioner that's gentle after the shampoo. Now, for people who make a lot of scale, like myself, I have to shampoo every day with a double shampoo. It does not hurt the hair. It does not hurt the scalp. What does hurt the scalp and the hair is tight braids, using a hot comb that'll destroy the hair follicle. Tension on the hair will kill the follicle, so tight braids. And then the hair, the straighteners, the alkalis that are used to straighten the hair will hurt the shaft of the hair, and eventually, if used frequently, it can kill the hair follicle and end up with scarring, hair loss, which is very upsetting to anybody that has that. So for certain dark skin ethnicities, I recommend staying away from the hot comb. Let your hair be natural. Shampoo as frequently as you need to get rid of scale. If you have true seborrheic dermatitis with redness plus the scaling, you may need some medication, like a hydrocortisone lotion, but you may need to see a dermatologist or your general doc to see if you do have a scalp condition that requires medication in addition to the scalp care that I mentioned.
So it sounds like similar to the skin care that we're talking about on the body. What you're recommending for the scalp is really gentle care, shampooing every day, following with a gentle conditioner. How would you counter those who say washing their hair frequently dries out their hair?
Okay, washing your hair every day is easy for me, but for you it might be a little tougher because you have long hair, and I see what goes on with long hair. It's a little bit more of a problem. So you wash your hair as often as you need to get rid of the dead cells without doing anything that's going to harm the hair follicles.
Another question that often comes up from our patients is, does this regimen for taking care of the scalp and hair need to change across ethnicities, or is this something that's okay for all ethnicities?
Well, what I just mentioned would be reasonable for all ethnicities. Gentle shampooing does not cause dryness of the scalp. As long as it's a gentle shampoo and you're using a conditioner afterwards and you're staying away from heat, which will destroy the follicle, or alkali, the hair straighteners, hot combs, that will destroy the hair. Because hair of, say, dark skin ethnicities or very curly hair, it is not, it may break more easily. So heat and chemicals are essentially your worst enemy.
Anything else that you'd like to add, Dr. Rhodes?
Oh, there's plenty I'd like to add, but there's probably not enough time.
I want to thank you for your time. We want to thank all of you for tuning in, letting us teach you about simple, sensible ways to take care of the skin and your scalp. My name is Dr. Barry. Thank you for tuning in.